Do you take antacids like PPIs? If you do, the odds are that it's inappropriate for you. Now, before you stop this and say, no, I really have acid reflux, I understand. And it's important to note that PPI medication, a type of anti-reflux drug, is one of the most widely prescribed medications around the world. So this was a review globally around the world, and they found that 60% of the prescriptions were inappropriate. The odds are that it's not appropriate for you. So let's look at why. The facts are that PPIs have a variety of dangerous side effects. These include increasing your risk of infection, weakening your bones so you get osteoporosis, increasing your risk for heart attack and stroke, along with dementia and kidney disease. And what they do is they imbalance your gut such that you get the very symptoms that got you taking them in the first place. So is your doctor ignoring these risks? No, not at all. I mean, people become doctors because they want to help. But in our conventional model, help is really defined as managing symptoms. And managing typically means medication. And certainly managing symptoms is a lot easier to control than figuring out why it started in the first place. Ask yourself, what's easier, swallowing a pill or changing your diet and lifestyle? Clearly the answer is swallowing a pill, and that's what conventional medicine opts toward. But does easier mean safer? Does easier mean better? Not when these drugs are associated with the side effects I just reviewed. Now, often what I hear from patients is like, okay, I get it. I get that there are side effects and it's terrible, but I'm still miserable with my acid reflux. So we're going to go into what you can really do about it and not feel like you're stuck between a rock and a hard place of I'm either suffering and I can hardly eat because of reflux, or I take a dangerous drug. Because I get it. That's not a fun place to be. So what are we missing? One of the very basic facts that we're missing is that your stomach is designed to be a bag of acid. It is that way for two critical reasons. One is the acid kills organisms, bad bacteria and various organisms that come with our food. And it's just natural, they do. It's not because you're utilizing bad food hygiene or something like that. They're in our food, they're microscopic, but the acid kills them, and that is your first destination. You put your food in your mouth, you chew, you swallow. The first place it goes is that bag of acid called your stomach. And when you reduce that acid, what happens? Those organisms don't get killed. So remember, the first side effect was increased risk of infection. And that's why these organisms thrive, they multiply, and now they can cause infection. So I mentioned two key reasons that you have stomach acid. The other one is that the acid allows you to absorb certain key vitamins and minerals: calcium, magnesium, zinc, iron, vitamin B12. And that happens in the stomach and it doesn't happen anywhere else. So if you don't have enough stomach acid to allow this absorption to take place, you are running the risk of deficiency. And just to harken back to one of those risk factors, if you're not absorbing key minerals like calcium and magnesium, that explains why you can get weakened bones like osteoporosis. Vitamin B12 is the vitamin that is absorbed in the stomach. You get deficiency of vitamin B12, you're more likely to get dementia and affect your heart. So that's why this happens. It's not hard to figure out. There's one other key nutrient that gets started in the stomach, and that is protein digestion. So it starts in the stomach. That breakdown of protein begins in the stomach, then it continues into the small intestine. So the stomach acid is performing very key functions that if you don't have it, you are going to run the risk of the side effects that I mentioned. But you still have the reflux. Why? That's the key issue. Do you have acid reflux because you have too much acid? That's kind of what everybody thinks, right? I mean, it's kind of insinuated, right? You have acid reflux and you're told, oh, here's an antacid. I'm going to decrease the level of your acid. So the insinuation is you're making too much and we're going to make sure you produce less and then all will be well. That's not true. You have to produce the acid. The reflux is not due to excessive acid production. Your stomach is not behaving inappropriately at all. What is happening that is inappropriate and wrong is that your stomach, that bag of acid, is getting squeezed. And when it gets squeezed because of external pressure that's pushing on it, then the acid has no choice but to come up out of your stomach into your esophagus, and that is the definition of heartburn or acid reflux. The acid is refluxing. It's going in the wrong direction, out of your stomach, up into your esophagus, which of course it should not do. Is it because you're making too much? No. Key point, no. It's the pressure that's being exerted upon your stomach. So you know the next question to ask: why is my stomach being pressured? Where is that pressure coming from? That's what we're going to discuss right now. And the exciting news is that it doesn't require an antacid at all to handle any of the reasons you have the increased pressure, which is why you have the reflux. So let's go through the list. Most of it is caused by not having enough acid and what happens as a result. So you can have what's called slow stomach emptying. Your stomach should turn your food around for about 2 to 4 hours to absorb all those good nutrients, and then it leaves the stomach and goes into your small intestine. If things move too slowly, you'll know it because you feel like things just sit there. Patients say, feels like I swallowed a brick, it's just sitting there, I'm so uncomfortable. That means you've got the slow stomach emptying. And a lot of times that happens because you actually don't have enough stomach acid, and or you have the presence of bad organisms, all caused by PPIs. Now, let's not only blame PPIs or acid reflux medication, because as we age, we tend to make less stomach acid naturally. Now, it's not normal, it's not ideal, but as we age, we make less, so we're more likely to get that slowed stomach emptying because we don't have enough acid. We're not killing the bad organisms. And that's not hard to handle with augmenting with some enzymes and hydrochloric acid. I'm not prescribing that for you. I'm just mentioning it. What's next is something called dysbiosis. All it means is that the organisms in the colon, in your lower part of your intestine, are not the good guys, as I like to say simplistically. So you have anywhere from 40 to 60 to 100 trillion organisms in your colon. And when they're of the good, healthy variety, you have got great digestion, your immune system functions optimally, your hormones are balanced, so all is right with your health when you have a healthy colon. What can happen as a result of taking the PPIs again? Remember, I mentioned the increased production of bad organisms. So you get more of the bad organisms. They make their way all the way down into the colon. So they cause imbalance. Having too many bad organisms also increases the pressure in your colon, which is increasing then the pressure on your stomach. So they all fit into one another. It really is, we're going through the various factors, but I want you to understand they all interrelate. As an example, constipation. So if you tend to have too many bad organisms in the colon, things tend to move too slowly, you get constipation, which also increases the pressure. Another factor is food sensitivities, foods that you're eating that you're having a bad reaction to, which can create not only the increased pressure, can cause constipation. There's also just an unhealthy diet, so not so much food sensitivities, because you can be sensitive to a food that's perfectly healthy for most people, but for you, it's acting more like a toxin. Or we can just be talking about an unhealthy diet full of sugar and processed food, fast food, seed oils, excess alcohol, all the things that we know are not part of a healthy diet, which unfortunately feeds those bad organisms, leading to the imbalance of the organisms in the colon, increasing the pressure, putting pressure on your stomach, and now we've got the reflux. So you can see they're all tied together. Also, there's abdominal weight. So not just overweight, but particularly overweight in the abdominal region, because the weight itself increases the pressure in the abdomen. So that's not like something like constipation, where then the constipation passes and the pressure goes down. You've got a lot of weight in your abdomen. It's putting pressure on your organs, all of them in the abdomen, and the stomach as well. So that can create the increased pressure and the reflux. Lastly, there's a component associated with what's called your vagus nerve. It's a cranial nerve, which means it comes out of your brain and it goes to all your digestive organs. And when there's a lot of increased pressure, there's constipation, there's the bad organisms, it offsets how the vagus nerve is functioning, and that can affect how your heart functions, how your lungs function, and you can get shortness of breath, you can get heart palpitations, which come along with acid reflux and sometimes leading to what's called hiatal hernia. But the vagus nerve is very associated with digestive imbalance. So let's say you have a lot of those organisms in the stomach because you were on the decreased acid medication. When those organisms flourish, that offsets the vagus nerve function. So those are very tied together. Working with the vagus nerve is natural. Really, all the things that I've mentioned so far have a natural treatment that is very effective. And that's what's exciting, is you don't have to, as I said earlier, sit there between, the rock and the hard place, the proverbial rock and the hard place of, listen, I have reflux, it makes me miserable. The antacid kills the acid, so I feel better. And now I have to worry about all these side effects. I'm at a loss. You don't have to be at a loss. There are alternatives, and those are all the ones I just mentioned. Now let's give you some real life tips of things you can do. I cannot tell you how often when we change a patient's diet, and this is early on, so when we work with individuals, we get them on a nice clean diet, and we also do laboratory tests looking at the microbiome, which is looking at the 60 to 100 trillion organisms in the colon. We look at various toxicity levels, and we do blood testing. So it just depends on the individual what testing we're doing. I cannot tell you how often, while we're waiting for the test results to come back and we begin with sort of just cleaning up their diet, how much better people can feel. So I'm going to give you that tip right away, and I'm going to make it really simple. What I want you to do, if you would like, I'm not your doctor, but think about removing all gluten, all sugar, and all seed oils. So these are processed oils from your diet for 3 weeks. So that doesn't cut out any form of protein. It doesn't cut out fruits and vegetables, nuts and seeds. It certainly doesn't cut out hydration with enough water. It doesn't cut out exercise. It doesn't cut out good sleep. There is plenty to eat. I'm not even cutting out dairy unless you have a very strong suspicion you don't do well with dairy, then don't do that either. But all I'm saying is gluten. Look up where gluten is hiding, because it's in certain liquids like soy sauce and beer. And I'm cutting out sugar, gluten, and the processed oils, the seed oils. So you'll see them in ingredients. Certainly if you're going, fast food is off the list at this point. You want real food, but a pretty short list, but you won't believe the difference potentially. So it's my strong tip number 1 for you. I have several. Number 2 is I want you to practice what's called diaphragmatic breathing. So belly breathing, because the vagus nerve being irritated by what's happening in your gut is really influenced by proper breathing. And what's incredible is a lot of research has been performed showing that training people how to breathe with their belly is really exercising their diaphragm. So that's your breathing muscle. And when you exercise your diaphragm and you make it smaller, it reduces acid reflux, because the diaphragm acts as what's called an anti-reflux barrier. Your esophagus passes through the opening of your diaphragm. That's how your mouth connects to your stomach, right? The tube called the esophagus. But the esophagus connects to the stomach, which is below the diaphragm. So the esophagus has to pass through the breathing muscle called the diaphragm, and right where it passes through, right at that juncture, there's a what's called a pinch cock valve. So it's a circular valve that is part of the diaphragm that acts to put pressure down to prevent reflux. But people who've had chronic reflux for a while, they tend to breathe shallowly, which has to do with their vagus nerve, and that valve is not working the way that it should. So you practice diaphragmatic breathing, and many research studies have seen people can lower their need for acid reflux medication just by practicing diaphragmatic breathing. So once you do this 3 times a day, there's a few different things you can look up. One is box breathing, where you inhale through your nose for a count of anywhere from 4 to 6. You hold it for the same count. You blow it out through your pursed lips for the same count, and then you hold the breath out. So you're just inhaling at the front end of the box, and then you're holding, breathing out, and holding it out before you breathe in again. And you want to do this for a few minutes. You'll also maybe find it very relaxing. If you're having heart palpitations, it can settle those down. So it has a nice variety of things. You can also look up a physiological sigh, which is similar. It's a very deep breath in and a very slow exhalation. Does the same thing, really works. It's like working out, just like working out any muscle. The diaphragm is a muscle. It's also an organ, and it can get incredible benefits. Okay, so those were the 2 more difficult ones. Now some easy tips. No tight clothes, especially if you're eating. If you have an empty stomach and you just, are going around your day, fine, but you don't want to eat with super tight clothes. You need the diaphragm to move. You need the motility or motion through the gut. You don't want a lot of, remember, it's all about pressure. So you don't want to increase pressure just by having tight clothes on. Also, chew well. Try to eat slowly, chew very well. That will enhance digestion. Don't eat at the end of the day. So have a good 2-3 hours, 3 is best, between dinner and lying down. If you can, take a little walk after meals, especially larger meals. Even 10 minutes will help digestion. Don't lie down on a full stomach. If you're really full and you went out and it's Saturday night and it's late and you're just like, oh, I so overate, take a stroll. If you're not comfortable being outside, just roam around your home. Just keep walking. You can be listening to a podcast, do whatever is comfortable, but walk until you say, okay, I don't feel like I'm full up to here anymore. Believe me, your digestive tract will thank you. In summary, PPIs are very commonly prescribed. A recent study showed that 60% of the time it's inappropriate. So it might have been inappropriate for you, and you're getting benefit symptomatically, meaning you feel better on it. It's important to know the downstream effects. The longer you're on it, the more likely you're going to suffer the bad side effects that I've been reviewing. You're not stuck with it. There's a lot of options. Yes, it requires diet and lifestyle changes, but you have to decide. It's your body. You have to decide if it's worth it. If you want to play, the Russian roulette of, I'm not worried about those side effects, totally fine. Again, it's your body. But I think a lot of people don't know about the side effects, or they feel stuck. They don't feel like they have options. And you do. So please share this with somebody who takes antacids, because it's important information. I think everybody deserves to know that they have alternatives and they don't have to be stuck with dangerous side effects. And if you like this information, subscribe to the channel, give it a thumbs up, send me a comment. I love your comments. I read them, I answer most of them, and we'll talk soon.